The field of regenerative medicine is a field that focuses on mobilizing the body's innate potential to heal and regenerate tissues when faced with injury. Most problematic chronic pains are the result of the body's innate capacity to heal being overwhelmed by either illness or repetitive mechanical stress. For example, mechanical neck pain and back pain are often caused by degenerative disc disease, which is a degenerative process of the intervertebral discs. Tendinopathies or tendonitis most often are the result of the body's inability to balance the damaging effects of excessive biomechanical stress applied over the years. Terrible neuropathic pain conditions such as trigeminal neuralgia, which is one of the worst pains known to man, is due to the body's inability to compensate for the damage produced by mechanical irritation to the trigeminal nerve at the root entry zone of the brain. All of these common problematic chronic pains are the cause of the failure of the body to regenerate injured tissue. The field of regenerative medicine attempts to assist the body's innate strengths in trying to regenerate tissue in order to win the battle against the degenerative cascade. Today, most medicines and injections used by physicians and applied to treat pain in chronic problematic pain conditions do little to regenerate the tissue and actually reverse the cause of the painful condition. Most of the time, the medication adds to temper or palliate. We now have, with some recent scientific breakthroughs in Israeli medical technology, the possibility to bring home some of the power harnessed in the natural forces of light and sound and bring them to the assistance of patients suffering from chronic problematic pain syndromes. There is now a wide body of scientific evidence showing that low-level laser therapy and low-intensity ultrasound have the potential to help assist the body regenerate tendon, nerve, joints, and reverse the effect of degenerative conditions that contribute to chronic problematic pain. Whether it is to reverse the degenerated tendons that cause problematic pains in the limbs. We have cases of MRI proven healing of what were refractory tendon tears with low intensity, low frequency ultrasound. Or in the case of neuropathic pain, we have had unparalleled success treating one of the worst pains known to man, trigeminal neuralgia, by using low intensity, low frequency ultrasound. Well, because of the fact that there are 6 studies in the literature showing that such ultrasound can help to regenerate and heal injured nerve, we believe that these forces of nature inherent in light and sound are actually helping us achieve tissue regeneration, and we are not just treating the pain, but actually we now have hope of reversing the underlying degenerative process in the tissue causing the pain. The Pain Shield therapy device consists of 3 components. The first is the driver, which sends the electrical current to the active therapeutic Pain Shield patch. The second is the green wire that you see here that connects from the driver to the device. And it's very important that one understands the anatomy of the Pain Shield therapeutic patch. There are 2 buttons that connect to the driver with the green wire, and then within the patch you can feel that there are 2 electrical wires that run from the buttons to the actual metal plate under the patch, from which there is the therapeutic effect. The therapeutic effect comes from this metal plate. It comes mostly from around the metal plate, not under the metal plate, so we always make an effort to place the metal plate right next to the site we want to treat, not necessarily over. But there is a wide dispersion effect of the treatment as discussed previously. What is important to retain in this segment is the notion that the patch is often too big to be comfortably applied to the site that hurts, particularly if that site involves the face or a small corner of the body, such as around the toes or around an elbow. In that case, it is permissible to cut down the patch to its bare functional minimum without losing any of the functional qualities of the patch. And that could be done very simply by cutting across this line and this line, as well as this line and this line, which gives you a reduced size patch. The only disadvantage of reducing the patch to this kind of dimension is the fact that the patch was designed to hold on to the body through an adhesive. And once one does that, the adhesive potential of the patch is greatly diminished, and one has to resort to Cobham athletic wrap dressing in order to hold the patch onto the body. 3M Cobham athletic wrap dressing is a dressing that is elastic, well ventilated, and sticks to itself without glue or Velcro. If one wraps the dressing around the Pain Shield therapeutic patch and around the limb, whether that is, by the way, the face, the head, an arm, or leg, one will find that it adheres quite well to the body without being sticky. It can be wet and doesn't lose its grip, and it's breathable enough to not cause the therapeutic ultrasound patch to overheat. So this is the recommended technique for holding the ultrasound patch to the body, especially when the patch has to be cut down in size in order to be able to fit comfortably on the treatment area. The tremendous advantages of this new Israeli surface acoustic ultrasound technology is that we can apply the decades-old concept of phonophoresis, that is, using acoustic waves to mechanically drive medicines from the surface of the body into the tissues over a much broader surface area. It used to be that phonophoresis could only be carried out from under the ultrasonic transducer, whereas now the ultrasound patch produces a wide field of about 20 centimeter diameter of surface acoustic ultrasound. This means, for example, that if we develop a compounded pluronic gel that contains medicines useful for the treatment of pain or the reduction of inflammation, in this case, this is a gel containing 20% ketamine, 5% amitriptyline, 5% gabapentin, 5% carbamazepine, all of which are drugs that are highly effective in the treatment of trigeminal neuralgia, but that can produce problematic side effects. We now compound this drug into a solution, and we could take a small amount of that gel, rub it on a surface area such as the face, and here, just for demonstration purposes, I'm going to put it on the hand. And when I apply the ultrasound patch anywhere on the hand, I get a 20 centimeter field of surface acoustic ultrasound, whether, of course, this is on the hand, on the face, or on any other area suffering from severe neuropathic pain. We now have randomized controlled clinical trials showing us that topical ketamine, for example, is highly effective at reducing allodynia. And there are many clinical trials showing that topical nonsteroidal inflammatory drugs can also be effective in reducing pain and inflammation. However, all of these drugs have potentially serious side effects. By compounding these drugs through a skilled compounding pharmacist in your area, or by ordering them through us and applying them to the area of pain, we often find that there is a tremendous synergy between the analgesic effect produced by the ultrasound itself as well as the medication effect driven via the ultrasound phonophoresis effect into the tissues. This has been particularly remarkable in trigeminal neuralgia, where we have clearly seen a strong synergy between the ultrasound effect and the effect of topical analgesic medication. I will now demonstrate how we apply the Pain Shield patch to the face of someone with trigeminal neuralgia. In situations where the face is too sensitive to touch and the person cannot tolerate a patch, then what we do is, if the person cannot tolerate a patch on the painful side, what we do is simply apply the patch on the contralateral forehead and wrap it with the Cobam wrap to the contralateral forehead. So for example, if someone has V2 territory pain, but they cannot tolerate the touch of a patch, we would go to the contralateral forehead, apply the patch, and wrap it with the Cobam dressing. In this case, we're going to be demonstrating, however, how we apply it to the right V2 territory in someone who would have trigeminal pain in that area. We would find the zygomatic bone, put the active patch right next to the zygomatic bone. I would ask you to please hold that. And then, using the Cobam dressing, we would simply wrap, not too tightly of course, because we do want it to be comfortable. We would do sort of a twice around. Let me just adjust that. Sorry. Do twice around with the Cobam. In order to make sure the patch holds firmly. In which case we could just cut the Cobam, as we're going to do here. And again, you have to remember that the person is going to sleep with this patch, because the treatment generally is an 8-hour overnight treatment. It's not a terribly uncomfortable thing to wear. The patch is very light and quite elastic. It holds the patch snug against the face, the ultrasound patch snug against the face, without being constricting. The person can easily swallow, breathe, open their mouth, if you can open your mouth please for demonstration, without any significant restriction from the dressing, because the dressing is light, elastic, and breathable. So once again, we can cut down the patch to make it smaller, to make it fit easier on the face, as long as we don't cut through the wires that connect the electrical driver to the metal plate on the patch. And the patch should be held, in most cases, to the face with the use of this elastic, breathable Cobam dressing. I'd just like to emphasize the ease of use of the Pain Shield ultrasound device. As you can see, the device is about the size of a cigarette box. It has one button, so it's kind of foolproof. You press about 3 seconds and the machine starts. It works automatically, on for a hour, off for a half, on for a half hour, off for a half hour, for 8 hours, then it rings and stops. It's as simple as that. It's very hard to make a mistake. There's no particular direction for the connection buttons. And of course, one can wear the device on a belt and send the patch to wherever one needs treatment, whether it be on the face, the shoulder, the elbow. We can run it inside the shirt, or we can run it inside the skirt or pants to get to the foot and ankle area. Of course, once the patch is wrapped, it'll hold on sturdy with the athletic dressing that we demonstrated. And a person, if they want, could even treat themselves during sport or during activities of daily life with the device, which is highly portable, light, and it charges like a cell phone. We're now going to demonstrate the use of this new Israeli low-level laser therapy technology. It is one of the unique devices that is handheld, can be used independently by a patient at home, and yet has sufficient delivery of joules at the right wavelength and frequency to be consistent and congruent with the standards for treatment applied by the World Association of Laser Therapy. In this case, we will ask the patient to show how she would treat herself by simply applying pressure with the device onto the painful area, and with a light pressure As you can see, the green light lights, the green light is not the laser is infrared and is not visible, but as the green light lights, that's just to let us know that the treatment is being delivered. There's also a very small audible click that occurs every few seconds to let the patient know that there is in fact active treatment being delivered. And the idea here is that there will be 6 minutes, about 6 minutes of treatment applied to each painful point twice daily. So if one has multiple painful points, one can plan about a 36-minute treatment session twice a day in which he can do up to 6 points. He does 6 minutes per point. It is of no therapeutic value to do more than 6 minutes per point, but one can do as many points as he wants. Generally speaking, a reasonable quantity of points is 6 points. It could be 6 points around one joint at different areas of the joint, as it could be 6 different points in 3 different places, such as shoulder, elbow, and wrist in patients who need that kind of intervention. This is low-level laser therapy has reached level 1 evidence of efficacy. There is more scientific proof for its efficacy than most conventional medical treatments applied in pain. It is a very versatile treatment, and with this new Israeli technology, this treatment can now be given in the hand of the patient who could apply it independently at home.